good afternoon, Jamaica and world. This video is to help people in underdeveloped countries that deal with gunshot wounds. I've been coming to Jamaica for 30 years. I've lived here on and off over the years. I've seen and witnessed a lot of people shot and dead on this island. I've also witnessed the immediate reaction of locals when people get shot and the panic that occurs, which is a normal thing, because when somebody you care about or your brethren gets shot, you react. So for me, I wanted to make it a video really to give you a little bit of tips on how to treat a gunshot wound, because so many of you react in certain ways, and when I'm watching as an outsider in, those ways can actually enhance the likelihood of death of the people who have been injured, shot or stabbed. So for example, I saw a guy shot years ago and people were picking him up by his arms and dropping him. Now if he had a bullet in his vein, that bullet would move. There has to be minimal movement with the shooting. What you do is you check for pulse. That means to see if they're still alive. You can check in their neck or on the backs of their wrist with these two fingers, and if you feel a ba-bum, ba-bum, you know they've got a pulse. Sometimes it's not strong, sometimes it's very weak. You have to really feel for it. You have to check that their airways are clear, that they're not drowning in their own blood, and if that is the case, very gently you rock them onto their side and clear their airways. You can use a lollipop stick to keep their tongue down to help them, but then you must assess where they're bleeding, and the most important thing is compression on those wounds. If there are 6 wounds, you need 6 hands, unless you have a lot of hands that can put cloth on and then you can wrap them in a clear wrap or something so you can get them to a hospital. You need to find an old door or piece of plywood. You need to stop moving them from the ground by their hands and feet and bending their bodies. This can make bullets move in the body and make them lose more blood. I know you don't know this, but it's something for you to understand in the future. Do not bend them up, pick them up by their arms and legs and put them in any vehicle. You can actually make that wound and those injuries far worse just by that one action. The rest of you from the first world countries are probably thinking, why not call an ambulance? Well, this is Jamaica. When you call an ambulance, they ask you who's paying before they'll send out a paramedic to help you. Most people are put on the back of police vehicles or the back of scrap vehicles or lorries or pickup trucks and just transported to the hospital. And people pick them up and literally fling them in, not realising that motion itself can make bullets move and be responsible for the death. So please, I beg all of you, if somebody is shot, keep them as still as possible. You move them very slowly. You put pressure on every wound and you do not take your hands off that pressure until you get to a hospital and a nurse puts their hand over your hand to relieve that pressure, because blood loss is the biggest way someone's going to die from gunshot wounds. Stab wounds the same way. Now if you're in the country, in the middle of nowhere, and you feel like, oh my gosh, it's a 3-hour drive to Kingston, they're never going to make it, you can cauterise the wound. Even if the bullet's inside, I've seen people do this where they will literally heat up a knife and cauterise it. If it's a through and through, that means it's gone straight through, then that means there's no bullet in there. So you can cauterise both sides. You sterilise it with rum, you heat a blade, and then you just hold it on until you see no blood coming out, until you can get that person to a hospital. These are all makeshifts to get people to the hospital alive in the first instance, so then at least a doctor and a surgeon can work on them and try and save their life. So many people die on the way to hospital here in Jamaica because paramedics are not sent out like in England and America. I mean, you know, even in the UK, if you're a tourist and you dial 119, an ambulance will come to you. It won't say, are you a British subject? Do you have the right to remain here? And who's paying for this ambulance? That doesn't happen. But in Jamaica, you could have 10 kids bleeding out on the highway in a bus accident, and you call an ambulance and they want to know straight away who's paying. So you witness things, you hear things. I've come here for 30 years, I've lived here on and off, I've seen many things here, and I see a lot of reaction. And what people need to understand is that the body is the spiritual being. We are body, mind and spirit. If somebody is shot, they may not move or be able to move or respond to you, but their brain can hear everything you're saying. At that point is when it's very important that you hold that person's hand, you talk to them and you tell them, do not sleep. Can you hear my voice? And you keep talking to them and you keep them conscious. Because if they go unconscious, there's a less likelihood of them waking up. So somebody needs to be talking to them all the way en route to hospital, giving them that encouragement. You imagine how many people are put on the back of police pickup trucks, and I big up the police for the fact they turn up and they take them at no cost. I big them up for that. That's one thing I cannot say about Jamaican police. They will literally turn up and they'll put a body on the back of their vehicle and carry it to the hospital, and it's not about money. You call an ambulance, it's a different thing. But the body is a spiritual being. If you are on your own, you lose hope. If you stay with your brethren and you keep saying, fight, fight, we soon get to the hospital, you're going to be fine. You got to fight it, the brain will fight. The mind is a powerful thing. That is what keeps a lot of people alive, even when they get shot 30 times. And they should never come out. People that get shot in the head, that come out of surgery, and they may not be 100%, but people are even shot, they've even come out having been shot in the head. A lot of that is the medicine on the way to the hospital of your loved ones telling you to stay with them, because then the brain fights. But the brain is in confusion when it's injured, so it needs guidance, reassurance and love. That is the medicine. And then you put pressure on the wounds that are bleeding to stop the person bleeding out. You get an old door or an old piece of ply and you slide that person very gently onto that piece of ply and door. You don't move them by their hands and legs. Doing that increases their chance of dying, because the bullets will move. And doing it to a gunshot victim or a stab victim, the minute you bend their body, you're pumping blood out of them. The blood loss is what kills most stab and gunshot wound victims. So you must check for a pulse. You keep them in the position. You don't move them or lift their legs and drop them. You don't do any of that. That's not proper first aid. Stop doing that. Jamaica, stop doing that. When people get shot, you want to lift them up, you want to move them, you want to, I realise you're concerned, but you're roughhousing them. And you're increasing their risk of death without even realising it. I'm trying to educate you as to how to save a loved one if they get shot. Innocent people get shot as well. So with stab wounds and gunshot wounds, you make sure they have a pulse. You turn them on their side and keep their airways clear. You put pressure on every single wound, and you don't take that pressure off those wounds until you get them to a hospital. Because if you put pressure and then you leave them, the blood starts pumping out again, and that's what you can't afford to happen with a gunshot victim or stab victim. I'm talking from experience of what I've seen, and I realise when people get shot, people panic. But if you want to save a life, in those moments you have to be calm and say, right, do not move this person. Where are they bleeding from? You can't see. Cut off their clothes, rip off their clothes. You're trying to save a life, preserve a life. If you don't do these things, people will die. They have less chance of reaching hospital alive. I am begging you all to follow these few simple things, and maybe, just maybe, you might save a life.